Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
While you may not qualify for senior discounts yet, you don't have to wait to get older to start the fight against getting old. You can start at any age by taking a few steps now to take care of the skin you're in so it will last you a lifetime. On this edition, you'll hear from skincare experts on skin do's and don'ts. I'm Janet Whitmoyer, your host. Welcome to Healthy Living for Life, a show designed to help you do just that. Stay tuned. My first guest is Kara Addison, a doctor of nursing practice specializing and certified in dermatology at the Associated Dermatology and Skincare Clinic of Helena. Welcome, Kara.
Thank you.
Let's start off by talking about prevention of sunburn and skin cancer since summer is here. Can you give our viewers some tips on that?
Absolutely. So with summer quickly approaching, the first thing the majority of us think of is sunscreen. The number one question we get is what SPF are we looking for? What type of protection are we actually looking for in those sunscreens? And so broad spectrum is the most important. The American Academy of Dermatology recommends 30 SPF. However, if you are lighter skin, we do recommend 50 and above for a little bit more protection. Also looking for zinc and titanium are the main type of chemicals that we're looking for as well. Using protection type of clothing, using hats, even UPF protective clothing, which they are actually coming out with some pretty good looks out there. And also seeking shade, especially between the hours of 10 and 4. We really do find that that's the time that we do get sunburned, and reapplying that sunscreen every 2 hours, which is usually where it gets us, are probably the most important things to think about this summer.
Okay, great. So are fair-skinned or lighter-skinned people more susceptible to sunburn and sun damage, or are there people with genetic predispositions to getting sun cancers?
So that's actually a great question. We do get that quite often, wondering, do my genetics have a play in this? And so yes, they do, especially with melanoma. So there's 3 main types of skin cancer: melanoma, squamous, and basal cell carcinoma. The sun increases the risk of all of those, but heredity as well. So if you have a family member that has melanoma, you have about a 40% increased risk of getting melanoma in your lifetime. About 1 out of every 10 people actually have that genetic risk factor where they had someone else in their family who had melanoma as well as them. Looking at things, I would probably say like basal and squamous cell, we do have a higher risk if we're lighter skinned because we have less melanocytes. And those are the cells, our pigmentation, that help protect us against the sun. But with having less of those, we're unable to protect ourselves and not able to be out in the sun quite as long without getting a sunburn.
Okay, so speaking of being out in the sun, can you tell us how the sun, or what we hear about the UV or ultraviolet rays, actually damage our skin?
Right, so we have UVA and UVB, which are both harmful to the skin. What happens is those sunburns we get, especially between the ages of 0 and 20 usually, in addition to later on in life, have a long-term effect. So when those rays hit our skin, they actually cause some mutations. And so our skin reproduces every 4 to 6 weeks. And those centers that reproduce our skin can get those little mutations over time. Most of the time our body can take care of those, but over time we don't have the same type of function, and some of those mutations will escape, causing skin cancer. Not only does it increase your risk of skin cancer, but also we lose our subcutaneous tissue as we age, and that makes the process go a lot more rapid when we have that sun damage.
Okay. Speaking of aging, I wanted to shift a little bit to dry and itchy skin. A lot of times seniors especially experience that. Can you tell us some things that people can do to help prevent that type of itching that goes on for them?
Absolutely. So whether it's winter itch or summer itch, people experience it at different times or all the time. It's called xerosis, so it's a chronic condition where we don't have the hydration in our skin. And especially in Montana, with the lack of humidity, we're all experiencing that. So different things that we can do for it is hydration, usually drinking about 8 glasses or more of water, which can be challenging, but trying to make that a habit is going to increase our barrier to the outside. Also using moisturizing moisturizers that especially don't have scents. Usually scents pull that moisture out of our skin. And so doing a daily moisturizer, especially right after the shower, is fairly effective.
That's great information to know. What about nutrition and vitamins? What role, if any, do they play in helping to alleviate dry and itchy skin?
So vitamins and minerals have definitely quite a few different ones that help different aspects of the skin. Especially when we talk about moisturizing, we think of omega-3 fatty acids. Those are important to help bind those molecules, our skin cells together, so we have a functional barrier. Different things for helping with aging, wrinkling, things like that would be antioxidants. So vitamin C, vitamin A, vitamin E, beta carotene, so things that we even find in our fruits and vegetables as well. Topical vitamin K can actually help kind of reduce some of the pigment changes that we see over time as well, sometimes even helping with bruising. And so those are a good kind of overview of things you can introduce or keep into your diet.
You said something about aging and the pigmentation changes in the skin, and that brings me to the issue of liver spots. We've heard of those. Should people be concerned if they have liver spots? So liver spots are one of the #1 things that we do see, and as we age, a lot of us get those, especially with our sun exposure in Montana. They're actually called solar lentigos, which I think sounds much better than age spots or liver spots. But what these are is they're areas of chronic sun damage. And so when we get those UVA rays, the melanocytes kind of come together, causing these larger brown spots. And so what we can do for that is really protection from the sun. These are usually normal for the most part. However, if they start to get red and scaly, have an irregular border or black flecks, it's usually good to go get those checked out. Okay. We only have about 30 seconds for one final question, and I wanted to ask you about skin tears. Yeah. That's an issue that older people usually have problems with. Can you tell us a little bit about what problems or what concerns seniors should have about skin tears?
Absolutely. So 3 different types of skin tears. When we do have an initial skin tear where there's a flap but no actual loss of skin, we call that stage 1. You want to actually bring that flap of skin, wash it with soap and water, and bring it back over, usually covering with a little Vaseline, and then covering it with kind of a Band-Aid just for an occlusion to keep it protected. Usually doing that, you want to make sure there's no adhesive around that flap so you're not pulling it off. If you have a 2nd-degree type tear, usually we've lost part of that flap, but you still want to try and reattach it. Put moisture such as the Vaseline and then cover and protect it. Gauze and Coband is perfect, and the stage 3 would be the full tear, and probably go and see your primary care provider or your dermatology provider.
Perfect. Well, thanks for the great information and super tips, Kara. We'll be back right after the commercial break.